Welcome, students, to a comprehensive lecture on pericarditis. We'll explore its anatomy, physiology, etiology, risk factors, clinical presentation, diagnostic tests, differential diagnosis, management strategies, complications, recurrence, post-pericardiotomy syndrome, tuberculous pericarditis, and advancements in research. Let's begin our journey into this captivating topic. The pericardium is a double-layered membrane that envelops and protects the heart. It consists of the fibrous pericardium, a tough outer layer, and the serous pericardium, which has two layers, the parietal and visceral layers. The pericardial space lies between the parietal and visceral layers and contains a small amount of serous fluid, which lubricates the surfaces to reduce friction during cardiac contractions. Understanding the intricate structure and function of the pericardium is essential in comprehending its role in protecting the heart. Pericarditis can have numerous causes, including infectious agents such as viruses, bacteria, fungi, and parasites. Autoimmune disorders, such as systemic lupus erythematosus and rheumatoid arthritis, can also lead to pericarditis. Other etiologies include myocardial infarction, radiation therapy, trauma, uremia, and drug-induced reactions. By investigating the diverse causes of pericarditis, we can gain insight into the specific risk factors associated with each etiology. Patients with pericarditis typically present with acute chest pain, which is often sharp and pleuritic in nature. The pain may radiate to the neck, shoulders, or back and is usually aggravated by deep breathing or lying flat. Patients may also experience fever, fatigue, dyspnea, and a pericardial friction rub, which is a characteristic auscultatory finding. Analyzing these distinctive symptoms is vital in accurately diagnosing pericarditis. To confirm the diagnosis of pericarditis, various diagnostic modalities are employed. Electrocardiography, ECG, is a valuable tool, with findings such as diffuse ST segment elevation and PR segment depression being indicative of pericarditis. Echocardiography can assess pericardial effusion, evaluate ventricular function, and aid in identifying other associated cardiac abnormalities. Laboratory investigations, including cardiac biomarkers and inflammatory markers, help support the diagnosis. Familiarizing ourselves with these diagnostic tests is crucial in accurately identifying pericarditis. Pericarditis shares overlapping features with several other cardiac conditions, including myocardial infarction, acute coronary syndrome, and pulmonary embolism. Recognizing the distinguishing features and employing appropriate diagnostic tests are essential to differentiate pericarditis from these conditions and avoid misdiagnosis. Acquiring the skills to differentiate between these entities is critical for providing optimal patient care. Pericarditis can be classified based on clinical features. Acute pericarditis refers to sudden onset inflammation, while recurrent pericarditis involves repeated episodes separated by symptom-free intervals. Incessant pericarditis persists for more than 3 months, and chronic constrictive pericarditis develops due to fibrotic changes. By categorizing pericarditis, we can better understand its diverse manifestations and tailor appropriate management strategies. Treatment options for pericarditis depend on the underlying etiology and severity of symptoms. Initial management usually involves nonsteroidal anti-inflammatory drugs, NSAIDs, and colchicine to alleviate pain and inflammation. In more severe cases, immunosuppressive therapies, such as corticosteroids or immunomodulators, may be necessary. Understanding the available treatment options empowers healthcare professionals in providing comprehensive care to patients with pericarditis. Pericarditis can lead to potentially life-threatening complications, including pericardial effusion, cardiac tamponade, and constrictive pericarditis. Pericardial effusion occurs when excess fluid accumulates in the pericardial space, potentially impairing cardiac function. Cardiac tamponade occurs when the fluid accumulation in the pericardial space compresses the heart, resulting in decreased cardiac output. Constrictive pericarditis develops due to fibrotic scarring, leading to impaired diastolic filling. Analyzing and identifying these complications is essential for timely intervention and improved patient outcomes. Recurrent pericarditis refers to the recurrence of pericarditis after the resolution of the initial episode. It can be challenging to manage, and identifying the underlying cause is crucial. Long-term management may involve the use of colchicine, corticosteroids, immunomodulators, or even pericardiectomy in severe cases. Understanding the causes and employing appropriate management strategies are vital to reducing the frequency and severity of recurrent episodes. Post-pericardiotomy syndrome occurs following cardiac surgeries or interventions and manifests as pericarditis. The exact etiology is still not fully understood, but it is believed to result from an autoimmune or inflammatory response. Patients may present with chest pain, fever, and pericardial rub. Treatment involves anti-inflammatory medications, with corticosteroids reserved for more severe cases. Familiarizing ourselves with this unique syndrome is essential for providing comprehensive care to postoperative patients. Tuberculous pericarditis is a specific form of pericarditis caused by Mycobacterium tuberculosis. It poses unique challenges due to its insidious and chronic nature. Diagnosis involves a combination of clinical suspicion, imaging, and laboratory investigations. Anti-tubercular therapy, usually involving a multi-drug regimen, is the mainstay of treatment. Understanding the distinctive features and management strategies of tuberculous pericarditis is crucial, especially in regions with a high prevalence of tuberculosis. Pericarditis continues to be an active area of research aimed at unraveling new treatment modalities, innovative imaging techniques, and potential advancements in prevention strategies. Ongoing research efforts are focused on the development of targeted immunomodulatory therapies, improved imaging modalities, and a more comprehensive understanding of the underlying pathophysiology. Staying informed about these advancements enables healthcare professionals to provide the best possible care to patients with pericarditis. In conclusion, pericarditis is a complex condition with different causes and management options. It's important for healthcare professionals to understand its anatomy, diagnose it accurately, and stay updated with research for better patient outcomes. Thank you for your attention.